The demand for traveling nurses has risen exponentially during the COVID-19 pandemic. They all have different reasons for joining the fight, like Grover Street, who recently got the vaccine.
Okay, ready? 1, 2, and 3.
Well, it felt just like the flu shot. Just like the flu vaccine.
Yeah, she did good.
Easy.
You are all done.
All right.
Street is a former Air Force trauma nurse. He's been on the front lines in New York, Miami, and most recently California. His wife, Dr. Sandra Guidry, has been working to ensure rural hospitals have enough staff. Her job is made riskier by the fact that she's a cancer survivor who is immunocompromised. Grover and Sandra are with us now to talk to us about the experiences from the front lines and what they've learned during this past 9 months. Grover, I want to start with you. Well, first of all, I want to say thank you both for the work that you are doing. It's really incredible, and I can't express enough gratitude. Grover, I want to start with you. What made you want to work on the front lines of this pandemic and risk your life day in and day out?
Well, I've always been that kind of person, and it takes a special person to do what we do in healthcare. I've always been that person, and I went to do this just to learn more about the virus, just to learn more about it. My wife and I, we discussed this in detail, and she said, you should go abroad and learn as much as you can about this pandemic. And that kind of pushed me out there to do what I did and to get more involved with taking care of these patients.
You have a background in military service, and now you're once again, doing some harrowing, life-saving work. How has your military experience helped you when it comes to being on the front lines of COVID-19?
Yeah, the front lines of COVID is nothing like being in a war. I have never seen so many people die throughout my life, let alone than, being in the military. So we've lost more lives during this COVID pandemic than I've seen in any war. And it's a tragedy to walk out in the parking lot and see coolers, trailer truck loads of coolers of bodies, because the morgue in the hospital's full, and we're having to put bodies outside and preserve them for the next, for the transition to wherever they had to go after that. But I think the thing we need to do, though, in order to prevent this from happening in the future, so life can go back to the way it used to be, we need to get the vaccine. We need to social distance. We need to wear a mask. Those are the things we need to do. And I think there's power in numbers. Many leaders have said it. We all need to get the vaccine, or as many of us as possible, in order for this to work.
It is just so striking to hear you say that this is unlike any of the battlegrounds that you've seen, and in a worse way. Sandra, tell us about your work with hospitals that aren't in big cities like the ones where Grover has been. What are those hospitals experiencing right now?
My position is to work with rural hospitals across the country to try to make sure that they stay viable and remain viable for their communities. And the issue that's happening right now is the fact that those rural hospitals have limited resources. And when they get a sick patient that is needing admission and they're taking care of that patient, they are unable to send that patient to the bigger city if they need a higher level of care, because those big city hospitals are overrun with patients and they're already running at 150% capacity. And so those are the struggles that we are having in the rural communities. It's very disturbing right now, especially with the holidays, where people are going to come together with their families like they normally do every year. They get together for Christmas, get together for New Year's, and that's when the virus is going to start spreading again in mid-January. And this is the time that people need to, even if you are visiting your family, wear a mask inside the home. I have my adult children here for Christmas. Everybody is wearing masks, and we are keeping socially distant inside the home. And as soon as the vaccine is available to us, we are going to get the vaccine as well, all of us.
It seems like your hands are sort of tied in these hospitals that are, in rural areas, and especially if there isn't a place to turn to in the larger city hospitals. I wanted you to talk about resources for a minute. How challenging is it to get resources to these hospitals?
It's challenging in every hospital, even in the big city, where we see that they're running out of ventilators, and those ventilators are used to help oxygenate patients when they can't breathe on their own. And so, if you can't get the necessary supplies and the necessary equipment, then we see that the patient will die. And so, that's the disturbing piece: is deciding who gets the ventilator. And then there's the issue about running out of the personal protective equipment that the nurses and physicians have to wear, the masks, the gowns, the gloves. And we had that issue earlier in the beginning of this COVID pandemic when we were running out of this, we call it PPE, personal protective equipment. And currently right now, we are not running out yet, but we're running low. And that's the issue with the holidays and coming into January, where those equipment that we use to protect ourselves in the hospital are running already at short supply.
That's an alarming picture that you're painting right
It
there,
is.
Sandra.
It is.
Yeah, it's just terrifying to think about, frankly. Grover, you were in New York, Miami, and California when each area saw some of the highest number of cases in the country. What did you see every day on the job, and what do you want people to know about that experience, especially people who have defied CDC guidance and are traveling during this time?
One thing that I saw was high burnout from nurses and doctors, overworked. The patient's acuity is so high. We get regular patients on a regular floor, whenever the pandemic's not going on. But whenever with this pandemic, those regular patients become a little bit more, increased responsibility to take care of. And so, with that said, to give you one example, I had a patient. She came in. She was an elderly patient admitted for pneumonia, and her daughter. We asked her daughter to stay with her because she had dementia. We didn't have enough staff working. This is why we asked her daughter to stay with her mother because of the dementia, and for the patient's safety, the daughter stayed, and she was actually diagnosed with COVID and pneumonia as well. So I went in the next day and I saw them, and the daughter was laying on the couch and her face was blue. So I took her vital signs, and her oxygen level was 75%. So this lady could have actually died on that couch. And I wheeled her to the emergency room to get seen. And that's just that's one case. But there's so many cases that I can tell you about. There was a patient, her sister would call every day to see how her twin sister was doing. And I say, she's okay. And then there was a time when things weren't so good. I went into the room. I would put my hands on her shoulders, and I would sing a church hymn to her, and I would pray for this sister of hers. Even though she was intubated, I know she probably still heard me. And I told her that her sister said that she's the strongest person she knows, and that she hopes that she gets through this. She ended up not making it, though. And that's just a couple of experiences with patients that I've had throughout this pandemic.
And the one thing we're seeing is the fact that once the patient comes to the hospital, they can't see their families, and their families can't see them. And that's a big tragedy where the patient ends up passing away without their loved ones at the bedside. And the healthcare workers are the ones that are their family now, and they stay with them and hold their hand. And as Grover said, he sang to her because she was a religious woman, and it's just so heartbreaking to see that these patients are dying without anyone by their bedside other than the healthcare workers.
Heartbreaking doesn't even begin to do this justice. I hope that when people who are acting selfishly and gathering in large groups, when they're doing that, I hope they think of people like you who are risking your lives every day. Grover Street and Dr. Sandra Guidry, thank you so much.
Thank you.
Thank you.